Did it come up? Rita, here you are. Rita's joining us as well. So Fran and Pam and Lois, and I'm not sure if there are going to be any other people joining us, but I'm going to do a short introduction here, tell you a little bit about Partners for World Health and some of the events that are coming up, which many of you may already know. And then I'm going to introduce Meg Cyr and Rita to talk a little bit about breast cancer survivorship. So I see that the only newcomer to this, actually Rita came down to see us recently with her colleagues from South Sudan, and we are planning on shipping them a container. So she knows a little bit about Partners for World Health for a while now. And Fran is a member of our board, and Pam is also. I see just one, you.
Is that just me?
Yeah, okay, welcome, Julie. Yeah, I know, I have it up here. Keep forgetting though. Okay. And Pam is also a member of our board of directors, and Lois is a retired registered nurse that volunteers with us a lot here at Partners for World Health. And Sylvie is up here in the corner driving to another location, which she'll arrive soon, who's a mutual friend of Meg's. And so Partners for World Health has been pretty busy these days, and we're in the middle of getting ready to ship another container tomorrow and another container next week. And the next week we have 5 more containers to ship before the end of the year, which is pretty exciting, including maybe even to South Sudan, to Magui in South Sudan, where Rita is from. So we're looking forward to shipping our 3rd container to South Sudan. We sent 2, one last year in 2020 in February, and another one in 2019 to Bor, South Sudan, which is north of the Juba area. So we put on these this month for October for breast cancer awareness. We decided to put on our program for global health would be just focused on breast cancer. And last week we had Suzanne Hoekstra, who's a surgeon, a breast cancer surgeon here in Portland, present information about treatment and surgical treatment and other options. And then Mindy Goldman, who's from University of California, San Francisco, where she teaches and works there as a GYN surgeon, but does a lot of breast post work for surgical work for breast cancer patients who need to have their ovaries removed or their uterus removed, et cetera. So she does a lot with different types of treatments and discussion and giving people a lot of different options when they've been diagnosed with breast cancer. So I'm also admitting Josh, and Josh is a long-term volunteer for Partners for World Health. He first started here when he was in high school, and then he continued through college, and now he's at medical school at Tufts Medical School in Boston. So we're pretty happy to have you here, Josh. Nice to see you again. He was here with us last week and is a big supporter of us down there at the medical school. So we have a few events coming up, which people are well aware of. We have the big Blue International Craft Fair that's happening in December 4th, where we bring back all of these international artifacts from all over the world and from our medical mission program. And then we put them on sale for that Saturday from 9 to 3. So we didn't have it last year, so we're looking forward to having it again this year. It's become a significant fundraiser for PWH, and it's a fun time to see people again and also buy up your Christmas presents. And then we have our big event that's happening in May of 2022, which is the Blue Wrap Project Runway Show, the fashion show of items made out of blue wrap. And also we're having entertainment and probably 3 or 4 different performers that will be mixed in with our fashion show. And it'll be a fundraiser, but also a time to share with everybody the importance about what Partners for World Health does and how there's not a PWH in every state in this country, but in every state in this country and in every hospital in this country, we are discarding medical supplies every day that could be reprocessed, repackaged, and then shipped in container loads to different countries that have dramatic needs as compared to what we have in this country. So that's part of the purpose of our Blue Rat Project Runway show this year, is to really get the word out about the need that we should be doing. We should really be focusing in on this everywhere in our country. We're also Thanksgiving. If you want to be a volunteer here in Portland, we are supporting the turkey 4-miler, which is on Thanksgiving Day. And that's a fundraiser, also a fundraiser for PWH, which has been organized by George Toll, who used to be the field coach at USM for like 30 plus years. So he's a great guy. And we're providing him with volunteers for that day. So we will do our next global health education program will be in November, and it's a physician who's from Bangladesh that works at the Rhode Island Hospital and teaches cardiac thoracic surgery, but he also started an organization called Health and Education for All in Bangladesh, and he works with providing cervical cancer treatment to all women in the rural areas of Bangladesh, and among other things, as a focus on primary health care as well. So he's going to be speaking about his nonprofit that he started several years ago. And then we hope to partner up with him at some point in 2022 on one of our medical missions back to Bangladesh. And then we will start up again in January. And we have a lady who organizes a organization called New Day Syria. And we have partnered with them for the last 7 years. You know, by the way, there's still a war going on in Syria, even though we don't hear about it every day. And we will, this year, we will have shipped to them 5 40-foot container loads of medical supplies, with one more going out in December, just before Christmas. So she'll be speaking about New Day Syria and all the work that they do to help the Syrian refugees in Jordan and Lebanon, but also help the Syrians in their country. Our containers go into Turkey, and then they're offloaded onto trucks, and then they're trucked into Syria to different hospitals. So to start this evening off, I want to introduce you to our 2 speakers this evening. First, I want to introduce you to Rita, and Rita is here actually in the space. She's actually in the room with me, in the conference room at our office, which we're really glad to have you here. And she's a mother and a daughter and a community leader, and she's very active in the South Sudanese community here in Portland. She's lived in Maine for over 15 years, and she's going to share with you her story about a little bit about where she came from in South Sudan, how she arrived here, and then her challenges when she found out that she had breast cancer. And Meg is my sister. She'll always say that I'm older than she is, but I'm just going to let you know that she's younger than I am. And she lives in Florida now. And Meg is a mother of 4 great kids, unbelievable great kids. And she's a registered nurse and retired. And she's also going to share her story of when she was diagnosed with breast cancer. So to kick this off, I've shared with them a few questions, and we'll go back and forth, but I'll have each of them give a little bit of an introduction, and then we'll ask some questions and have the discussion, which is a point of discussion. It's not a lecture, it's a discussion, so that if you do have any questions and you want to ask questions, feel free to just raise your hand. Or just raise your hand and shake it in the video, and then we'll stop so you can ask your question. So Rita, would you like to begin? So
Hi,
where are you from?
Hi, everybody. My name is Rita Achiro. I came here when I was 8 years old. I'm now 31. I came from South Sudan as a young girl. I'm now a mother, a daughter, a community leader, an activist here in Portland, Maine. I don't know what else.
Can everyone hear?
Can you guys hear me?
Yes.
Yes.
Okay,
So what was the question?
okay. And then Meg, why don't you say a few words about where you're, sorry, I'm muting. Meg, why don't you say a few words?
Well,
Introduce
hi, I'm
yourself.
Cyr, and I just returned from Texas to honor my son, who's a lieutenant colonel. I have to put that in there because I'm very proud of him. I'm very proud of all 4 of my children. I do have 6 grandchildren if they steal my heart every day. I am single and available. Yeah.
Okay, Meg, I'm really glad you got that message out there.
Yeah.
Okay, so let's talk. Is it okay, the echo?
Yeah, it's fine.
That's all right. So let's talk a little bit about how you first discovered that you might have had a lump or you thought about breast cancer. So Meg, why don't you start?
Well, my journey with breast cancer actually started with one of my daughters. My second daughter received a diagnosis of a triple negative breast cancer. And I moved to Nashville to help her through this whole process. Little did I know that God was training me for my own cancer, because 3 years later, I was diagnosed. However, I had a normal mammogram, and because of my daughter, I chose to have the BRCA gene test done, and that was negative. So I thought, I'm clear. But before I moved, I would winter in Florida, my physician assistant called me 7 weeks later and said, I think you should have an MRI of your breast, just because of my daughter. So I did that, and that's when they found my cancer. It was very small, and it was it's DCIS, ductal carcinoma in situ, which means it's totally located in my milk ducts. It had not spread, and I was 0 stage, which is very good. I mean, I was one of the lucky ones at that time. It was found very early.
And your daughter, how old was your daughter when she was diagnosed with triple negative breast cancer?
She was 27, very shocking. And she also was tested for the BRCA gene, and she also was negative for that.
Mm-hmm. And triple negative breast cancer, just to help people understand that, means that it's negative for estrogen producing, it's negative for breast progesterone, and HER2. So it's a very rare form of breast cancer, which is common. I shouldn't say common, it is rare, but it happens to young women. Tends to happen in younger women versus older women. Most of the older women with breast cancer have estrogen positive or progesterone positive or HER2 positive. So that's kind of how it's defined. So Rita, what about you?
Hi, everyone. Again, my name is Rita Achiro. So how I honestly found out that I had breast cancer was I've always been, like I said, a community oriented person. And it was the summer of 2019. I was so active. We had about 3 to 4 weddings that I was hosting. And the majority of the people there we had about 400 guests at one of the weddings. I was just an MC there. Throughout that summer, I did feel a lump, but like any normal person, I thought it was just a lump that was just there for the moment or for the time being, and that it was going to disappear. I think fast forward to, I think it was November 2019, a friend of mine had invited me out to go to a get together, and he was like, why don't you invite your friends? So I did invite my friends. I had wore a 2-piece outfit to go out. And that 2-piece outfit kind of showed, like, you can see like my breast, the top of it. It wasn't anything that was exposed thing, but it was enough to for the lump to be visible. So while I was in the at the get together, one of my friends looked at me and she was just like, what is that? And usually as a normal person, I'm very defensive for one. On a regular basis, I would be like, why are you looking at me? Why are you checking out my chest? To joke about it. But regardless, I've always been that defensive person. So I was just like, oh, wait, if she's seeing it and throughout the summer, I've felt the lump, then this is real. So from there, instead of being defensive, instead of fighting it, the next day, obviously not even the next day, I went home and I kind of started having a mini panic attack, anxiety to be exact. And I started going on Google, and that's the worst place to go to try to look for an answer or try to figure things out, because it wasn't giving me the results I was looking for, or maybe it was helping me in a sense, because I'm like, you know what? I'm reading these description of what a lump is, and it's not fitting the description of what I'm feeling, or I was just in denial. I didn't know. So I think the next day I took my phone and I called the doctor's office. I hadn't even gone for a checkup in a while. That was another red flag. You should definitely never wait. I called them and I kind of like described the lump, and it made them worried a little bit. From that day on, they scheduled me immediately, luckily, to come in on Monday. I think when I called them, it was either Friday. Yeah, I think it was about Friday or something like that. They immediately scheduled me to come in to get examined. And when I did get examined again, the nurse had me in a room. The doctor had me, she checked me and all that stuff. But I can also see that there was a worried face, expression in her body language. There was something off that kind of like alerted me. So I was just like, she's like, I don't know what it is, but I'm going to refer you to the breast center, or the breast center. And I was just like, she was like, they're usually busy, but I'm going to refer you there. And I'm like, that's a red flag. But I was still trying to be, as positive as possible. I'm trying to like let it not get to me, affect me, because again, we don't have it in our family. It doesn't exist in my family. And in my community, it's something that it's taboo. We don't talk about it. And whoever probably had it in my community, they don't share their confidential information. They don't talk about their medical history of anything of any sort, because again, most people that have cancer, they're looked at as like somebody who has HIV AIDS, so it's nobody talked about it.
Wow.
As far as I know, with cancer, it was something I read on books, I watch on TV, but it was nothing close to me. We don't talk about it. I just hear the words. I heard, I know it's like in October, but that was it. And that's where it ended. No medical history, not in my family. And the funny thing is, we did do a genetic, background check on me. They did all that gene stuff. They didn't find it at all. So this was crazy. Fast forward, I went and did the test. They felt over it and all that stuff. And the funny thing is, me finding out I had cancer was me being at home. The doctor called me after doctor hours. I think she knew that I needed the answer, and I was really like very concerned. And she told me while I was home that I had cancer.
Wow.
Like anybody, my world stopped. I felt numb. I felt confused. I felt lost. I got very emotional for one. I started thinking about my daughter, who at the time was 6 years old. And then I thought about the community. I thought about everyone, and then you start kind of like asking God, why me? I had that moment where I'm like, I don't even smoke. I don't even drink. How can I have cancer? At 29, I was only 29 years old at the time. And then from there, even that phone call I had, they didn't tell me what stage I was, what kind. She did a little bit, but she was like, you know what? Don't go to Google. That's the worst thing to do right now. She told me, I know that's what you're thinking, but I'm telling you, don't go there. Don't. Fast forward, we ended up meeting up. So this is the second time I'm going to New England cancer specialist. I had a referral to go to the breast care. Now I'm going to the breast care thinking it's just a breast care, not realizing that it's basically a building, and on the side of it, it says New England cancer specialist. Now, as somebody who doesn't even know that they have cancer, that's scary to just be like, okay, breast care, but it says New England cancer specialist. So now, even moving forward, I started thinking about, wow, I went from going to get an examination
To a
to
diagnosis.
being diagnosed with that cancer, to being a patient, you know, in that facility. It was
Yeah.
scary, you know, but I remember my doctor putting me down and telling me this is what it is. I had no choice. Like, you know, other people have that options of whether they're gonna have chemo or not. I didn't have that option.
Mhm.
I was at a stage of you need that chemotherapy. There's
Mhm.
no if, buts, or whys. There's
Mhm.
no choice.
So Rita, tell us, was this stage 0 or stage 2?
Um, I was a Herceptin
Positive, okay,
positive 2. And so basically mine, I was a stage 3
stage 3,
because yes, stage 3 due to the size of my tumor.
yes,
So when I went in, I was actually 3 centimeter.
3 centimeters tumor.
Yes. Yep.
So and you had the gene testing done, the genetic testing done, and you were negative back then for the BRCA gene.
Yes.
So is to share with you also, when Meg had the BRCA gene testing done, that was many years ago when there was only one BRCA gene. And now there are many, many new genes that they have found over time. And so there are different types, and they have found that there are different types of BRCA genes out there in relationship to and into relation to genetic testing for breast cancer. And that's really important to know about today, because the new drugs that have been developed in the last 10 or 15 years are actually targeting certain types of genetic positive cancers. So it's interesting that from your perspective and from Meg's perspective, there's no genetic history involved and no family history on your side. However, there is family history on Meg's side, because Meg's mother and Meg's mother's sister also had postmenopausal breast cancer, and her daughter had breast cancer. So there's a familiar risk factor associated there. So Meg, tell us a little bit about what was your treatment when you were initially diagnosed.
Well, when you talk about that extended panel, I did have that extended panel done to see if I presented with any of the breast cancer genes, and that all came back negative for all cancers. So when I was diagnosed, of course, cancer hits you, it comes right through the back door. Your whole life, as you knew it, comes to a severe halt. And you, as Rita said, you're so much is going through your head that you really need to start just focusing on what you need to do one step at a time. I learned from my daughter that tears don't take away cancer, and tears are a waste of time. She was very brave and she was very courageous. In fact, every time she went for chemotherapy, she coined the phrase, "I'm the lady dressed to kill cancer cells." And so she went in ballroom gowns and prom dresses. I mean, we ran out of them. We had to go to Goodwill and buy more. However, she taught me how to be strong. In those 3 years that I helped my daughter through her cancer, I had no doubt in my mind that I prayed that it would be me. And little did I know I was going to get the diagnosis, but I didn't waste time. I didn't waste time crying and worrying about my future. I said, I gotta get information. I gotta educate myself. I gotta figure out how I'm gonna kill this cancer and move on with my life. And so it was that the first thing you do is you want that out, because you don't want it growing still. And I wanted it out right away, but my doctor couldn't operate on me for at least a couple of weeks. And I said, well, that's not going to fly. I'm not going to bed with this growing in me. So I called my big sister, Elizabeth, and Elizabeth found a doctor in Portland, Maine for me. And I was on the table 2 days later. I had a lumpectomy and I had very large breasts. So I chose to have breast reduction at the time to get a lot of the breast tissue out so it wouldn't come back. I also chose, which was not necessary, but I chose to have all the nodes removed out of my right arm. None of my nodes were positive, but I chose that because there's always one little sticky cell that can hang around. And I didn't want any chance that it could pass up to someplace else in my body. So I was told that after the surgery, I just needed 7.5 weeks of radiation. I did not need chemo at the time. So I started my radiation treatment.
Mm. And so Rita, how did your story evolve?
My story actually gets a little bit interesting. So when I did find out I had that cancer, I told my doctor, I was like, I gotta go. She was like, what? I said, I'm going to Australia. She was like, what do you mean? I'm like, I gotta get out of here. Like I had already before I found out my diagnosis, planned on going to Australia to see family members that I hadn't seen in years. She didn't obviously want me to go. And again, not knowing my diagnosis or how severe the cancer was or how aggressive it was, I just needed to leave. And it was more so for peace of mind, to be honest. I felt like just finding out that I had cancer, it kind of like weakened me. It made me feel, it didn't give me strength. I felt like I needed that getaway to kind of come back and be strong enough to like take over, kind of like fight this cancer. I knew it was going to be a fight that was going to take a long time, but I needed to be 100%. And at that moment, even just finding out that I was stage 3, I didn't have that in me. I was probably 5%. That percentage was not going to give me enough confidence to fight the cancer. So I did end up going to Australia. My mom kind of gave me a blessing, her blessing. I went to Australia. Being in Australia, I was happy. No one knew I had cancer there at the moment until I started feeling pain. Like it felt like, because, I have a child. I felt like a mother who just had breast, had to deliver the baby, and the next day my milk came in. So that pain was so extruding. Like I felt like a wire was pulling my breast, but it was the tumor growing. Because like I said, my type of cancer was so aggressive. It was the type that would, like every day it was growing. I would be sleeping, it would be growing. I'll be walking, it was growing. So every second of every moment, it was just growing. Especially knowing that I didn't start that chemo. So when I came back to Maine, because the pain was too much, and I was like, you know what? Australians don't have my medical record. They don't know what's going on with me, and I can't put my life on, I can't risk my life. Now I did my part. I had a good time. I saw family members. I need to go home. I need to put me first now. And I had that courage now. I had that confidence to put my cancer above anything, my health. So when I came back, we had some complication with even me talking to IVF because of freezing eggs and stuff. They finally contacted me. Prior to that, we were having bad communication with them. They needed a referral. I told them my doctor's office sent a referral. They were like, no, we didn't get it. I was just like, are you guys playing? You guys serious? Like, I felt like they were playing with my life. Like, I need to get stuff going. I'm 3 centimeters, like it's growing. I need to either freeze my eggs now or start treatment. So I had no time, basically. Time was not on my side at all. Push forward. I went to that doctor's appointment. She took the ruler again, measured my tumor. I went from 3 centimeters to 8 to 10 in 3 weeks. That's how aggressive it was. And she was like, whoa. And I was just like, okay. So after that, I ended up calling IVF. I spoke to them. I said, hi. They were like, hey, we've been trying to contact you. I'm like, yeah, I've been trying to contact you guys for months.
Mm-hmm.
And they're like, yeah. Then I was like, okay, they're like, well, for one, Maine Care doesn't cover that. Private insurance doesn't cover that. And I'm just like, it's not something I want to hear, being diagnosed with cancer. Now I'm hearing so much. I already heard bad news. I don't need more. So I was just like, okay, what can we do? She's like, we have scholarship. I'm like, all right, moving forward, what do you need from me? They're like, we need to do blood work, all that. I'm like, okay, how long is that gonna take? He said, I think 4 weeks. I said, huh. In my head, I'm like, it's a no. I just went to Australia for 3 weeks and it doubled. If I wait an additional 3 weeks for
Right.
blood work, where is this cancer gonna go? And that
Right.
was my decision. At that moment, I was like, okay, I'm like, all right, just call me Monday. But that me saying that, it was more so I can't. I have to move on with treatment because my life at this point depends on that.
Right.
You know, I have to make that decision. And I spoke with my mother. She was very, very supportive, you know. And again, I'm lucky because she came here in the, you know, the late 90s.
Oh,
I fear for people whose parents are not culturally, you know, they don't know how to handle that. Or sometimes they're like, you know what, think about the child. No, my mom's like, put yourself first. And I appreciate her for being that support system I needed at that moment, you know.
Sure.
So moving forward, I went to that doctor's visit. I was like, you know what, let's start. And they were like, what? I was just like, yeah. So we started. I did my chemo. They said it was like 8. I had to do like 8 session. I switched drugs. I can remember it. I had a bunch of drugs. For one, my first dose, I'll tell you guys, it knocked me out. My body was so in denial. It rejected the treatment. It was not happy about being, you know, having so much of that foreign chemical inside of me. You know, and again, when people tell you what to expect as a cancer patient, it doesn't register. You're thinking what they're saying is just words without realizing that what they're saying is real. You know, and I got that front row of what that realness was, you know, that exhaustion. I was tired. When I was in 1 week, I dropped about 10 pounds. I was super exhausted. I would look at food like it was just nothing. I wasn't hungry. Everything was just funny. And I would test that, you know. Again, I forgot that I had cancer. So when I ate something, I'm like, why does the Slim Jim not taste like Slim Jim? So I would get frustrated because I'm hungry, but my taste bud wasn't going. I wasn't like the
Right.
taste of the food I used to eat weren't it wasn't the same thing. So I was very frustrated because of that. I'll try different stuff. Again, it wasn't registering. So it was almost like I gave up. I'm like, you know what? I'm not going to eat. Water didn't taste the same. It was one of the worst moments of my life. I'm not going to lie to you. I was just frustrated.
Right. And
Yeah.
how many weeks of chemo did you go through?
I did 8.
8 weeks.
Yep,
8 weeks. And did the tumor shrink?
it did. I did, was it 8 weeks? I honestly stopped doing chemo this past June.
This past June?
This past June. I started my chemo in January 2020.
So you've been on chemotherapy
Mhm.
since January 2020.
Yes,
That's a long time to be on chemotherapy.
yeah. That's how bad mine was. But the reason why my chemo was that long was because when I did first get my first dose, it rejected me. It was to the point where I remember going to work and I just had that chemo treatment. I went to work, I went to the bathroom, and I had this urge of like a pregnant woman wanting to pee bad. So I went to the bathroom and I had it. Then for some reason, someone told me to look down. So I looked down and I was just bleeding. So all my urine was just blood. It wasn't yellow, it was just red. So fast forward, and it was scary because it gave me like this stomach pain. I went to the emergency room. I was able to talk to my doctor, Dr. Weisberg. She was very good with communicating with me and not having me freak out. We found out that the reason why obviously that was happening was because of the chemo treatment. My body was like rejecting it, and the dose was too much for me.
The dose
at
was
once.
too much.
Yes.
Exactly.
The dose was way too much. So instead of doing every month or every 3 weeks, I ended up doing every week. They had to basically
Lower the
lower
dose.
it down, the doses down, and have me go there weekly versus monthly. So I think that's why it pushed
Right.
it further. Mhm.
So you were diagnosed then in 2019,
Yes,
and then you started the chemo in January 2020, which was probably, as you said, a high dose chemo and maybe a dose that was too much for your body to handle. So they had to lower the dose and then give it to you over a longer period of time.
that's correct.
So interesting story, because you're just finishing your chemo now and you've noticed a major reduction in the size of that uh, nodule. You've noticed a reduction in the size of the lump.
Yes, actually what I did end up in I think it was July 2020. I had unfortunately I did end up getting COVID. I think it was a couple of weeks before I was supposed to get my double mastectomy. So basically both breasts removed. I ended up getting COVID. So they had to basically, postpone my surgery. I waited it out for, I think, another month, and then I had the surgery. So as soon as I did have the surgery, good thing is my doctor was able to tell me that I went from a size, the 8 to 10 to dots. So it was just like, I think it was like millimeters. I think it was like 3 millimeter. So that was how they were like, wow. But again, prior to that, I remember that doctor even coming into my room, when I did first get diagnosed, and she didn't mean to, but it was just that, oh my God, like that, her looking at me like that doctor who's coming to tell you a bad news.
Yeah.
That you were not probably going to make it. I had that. I'm a CNA. So I saw her face expression and I saw her concern. That was her, her empathetic, like her being like, giving me that motherly, oh my God. But I felt it, and from somebody who's been in the industry for a long time, she probably didn't think I was going to make it. And that's scary. And then even hearing that my nurse practitioners basically telling me that, Rita, you fought death head on after the
Right.
fact.
So Rita, you had your mastectomies in the fall of 2020?
I had my mastectomy in actually the summer,
This
July.
summer.
Yep. It was
This summer,
no. 2020.
2020.
Yes.
Okay. So let's return to Meg, because Meg's diagnosis was a little different in terms of being stage 0 breast cancer. And then Meg, was it estrogen or progesterone positive?
It was ER positive.
It was ER
Yes.
positive. And so she had breast reductions, as she mentioned, with major, so she could have a lot of tissue taken out with greater likelihood of it not returning, and then had radiation for 7.5 weeks. And then fast forward 12 years later, what happened, Meg?
Well, I went on to live my life and be a proponent for breast cancer and to help others with their diagnosis. But at one point, I noticed a bruise the size of a dime on my breast. And I thought, well, that's odd. I don't know where that came from. And I had already had a mammogram scheduled. So I was like 3 weeks out. I said, I'll check in with the doctor. So I went to the doctors and the mammogram was negative. And I said, well, what do you think this bruise is from? And she said, oh, I have no idea. And I said, well, can you ask somebody else? So she had another doctor come in the room, and the doctor said, well, you must have bumped yourself. And I would know if I bumped myself, but it was a very small bruise. And I thought, well, okay, they don't know what it is. They don't seem very concerned about it. So I said, well, so they did an ultrasound on my breast and there was nothing there. There were no tumors. There was nothing present. I just had this discoloration in the size of a dime. So I proceeded to move to Florida and tried to get a doctor to see me here, but it was very difficult. And so when I returned to Nashville to see my children, I went to another doctor and I asked for a biopsy. I said, it's been 7 months now and the bruise has not gone away, which that's abnormal. A bruise would always go away by that time. So I got the biopsy and I came back to Florida, and little did I know, had absolutely shocked me when I got a phone call 5 days later telling me I had the most aggressive cancer and I needed to start chemotherapy immediately. And I here comes cancer back through the back door again. I'm like, really? Well, what kind of cancer is it? And they said, this cancer is caused from your radiation that you received in 2007. It is called radiation-induced angiosarcoma of the breast. Now, this is a very rare cancer, but I'm very lucky in life. And so I was diagnosed with this rare cancer, and I put everything in a bag and I went back to Nashville and I started my chemotherapy right away. I had 18 let's see, I had one dose 1 week to the next, and then I had the third week off so I could recover from my weakened immune system. And as Rita said, chemotherapy is not fun. It causes a lot of pain in your bones, causes terrible nausea, and you do the best you can to make it through because you know you need it, and you need it to kill the cancer cells. So after 2 weeks of these drugs, my hair started falling out, and I got really excited because I'm thinking, wow, this is killing my hair follicles. It's got to be killing my cancer. So I continued on, and by the 18th treatment, my bruise was gone. It was a miracle. My bruise was gone. And my oncologist at Vanderbilt Medical Center told me I was cured. She said, you are my success story. Well, I'm a nurse, and that didn't make any sense to me. Well, how could I have the most aggressive cancer and an 18 doses of chemo? Now I'm going to live forever. That didn't make any sense. So I said, I got to get another opinion. And before I did have bilateral mastectomies at that time for curative purposes. They want to get all the tissue off. So I recovered from that and was ready to return to Florida, but I got a call from my surgeon who told me I need to discuss the pathology report with you. And I said, oh my God, I've totally forgotten that. I figured I'm cured. I don't have any pathology to talk about, you know? And guess what? I was loaded with angiosarcoma. Every biopsy they took after they took off my breast was positive for angiosarcoma. So I was not cured. I was not ready to forge on with my life. I had to get smart, and I had to really decide what I'm going to do. If she's wrong, then I got to go and get a second opinion. So my daughter drove me to Georgia. We went to the Cancer Treatment Centers of America, and they are a wonderful, wonderful place. And I was evaluated there. However, after my evaluation and some testing, they told me I had 9 months to live. And I will tell you, that really hit me hard. I didn't believe it. I said, first of all, don't ever steal my hope as a cancer patient. And you've just done that by giving me a number. And you're not in charge of my life. The God above decides who's going to live or die. And I thank you very much for your opinion, but I'm going to go get a third one. And my sister Beth, who was there, my sister Elizabeth, who's always older than me, got me an appointment at MD Anderson. Now, this is during COVID and nobody can go with you. And so I jump a plane and fly to Houston, and I meet the doctor that has given me back my hope. And Dr. Ravi is head of the angiosarcoma clinic at MD Anderson. And he said, where have you been? You should have been here 7 months ago. At no time should that doctor have stopped my chemotherapy. This is not a slow growing and a low grade cancer. This is always a high grade cancer, and it spreads very quickly to the lung and the liver. And you need to go on 55 more chemos immediately. So I proceeded to move in with my daughter in Dallas and started the chemos under the direction of Dr. Ravi at Baylor and Scott in Dallas.
So that, and you did do those many chemo treatments. I just want to talk a little bit about how you both handled chemotherapy, because you both agree that it's the hardest thing to go through this, and you have these incredible complications and symptoms and fatigue and nausea, and also potential neuropathy. And Meg, why don't you share that story about the suggestion on how to handle neuropathy which is tingling and numbness in your hands and feet caused by the chemotherapy. And interested to know, Rita, if they gave you this suggestion.
Well, my doctor, Robbie, I said, I will do anything you tell me to do. He said, I'm going to keep you alive, Meg. He said, I'm not going to say you don't have to go back on chemo, right now, but that may happen down the road. This cancer is 80% recurring cancer. And I just looked at him and said, well, somebody's got to be in that 20% category, so I'm going to be there. That's where I'm going. And he proceeded to tell me, while you have your treatments, you need to do this. You need to submerge your hands and your feet into ice baths, ice cubes, and the coldest water possible. And you need to do it an hour before your chemo and during your chemo and an hour after. Now, the nurses never heard of this. And so when I went in for my chemo, I told them that's what I needed to do. And they said, well, what's that for? I said, well, basically, I'm not really sure, but my doctor told me to do it and I'm doing it. So they brought in the buckets, they wrapped me up in warm towels, and I'm telling you, it was the most excruciating experience I ever had. And I dreaded chemo every day because I had to do that. But I am so grateful because today I have no neuropathy. I have no tingling. I have nothing in my feet. And several people I know that have gone through chemotherapy have lost toes off their feet and had to learn how to walk again because nobody shared this information with them.
Rita, have you ever heard of that?
I have, and they did kind of tell me that, throughout my treatment that I would be having, those tingling in my feet and my hand. I did feel it in my feet, but I think I was so exhausted and it took so much out of me that fatigue was more so of what was, I was more sleeping. I was sleeping more, I think my body was so exhausted that the tingling wasn't as, the number one concern. It was more, my body was just knocked out, and that I was super weak. I wasn't even able to process anything that was going on with my feet.
So now you've both been through this incredible experiences of breast cancer and then complicated by stage 3 breast cancer in your situation, Rita, and then angiosarcoma in Meg's situation, to be hit with 2 major wows, really hit hard. And you're on the other side. You're on the other side now of, you've had your treatments, you've both gone through chemotherapy, you've both gone through mastectomies, and that's a difficult thing for any woman to have to face, to go through, and you're both on the other side. And what I hear is this sense of energy and this positiveness about all of these traumas that happened to you, but ended up with a positive outcome because you both want to share your stories and how important that is for so many other people. What do you think about that, Rita?
Wow. I know going through this experience, I had to, you think about the negative, but more so you also have to be like, what? God chose you or me to go through this for a reason, for a purpose. I've always been an outspoken person in the community, and maybe this had to be a wake-up call for my community, for people who are my age that didn't think cancer was real, did not think breast cancer was real, and even going through chemo, going through radiation, because I did go through radiation as well, after having both breasts removed. I had to basically, I didn't talk to anybody, to be honest, throughout my treatment, throughout my journey, because I was in denial. You know, I refuse counseling. I refuse any cancer group, whatever. And luckily, when I was going through this, it was during the pandemic. So a lot of stuff, resources were not available to me.
Yes.
So, and I was okay with that. You know, I kind of like, it was more so a time for me to kind of like, to, to, to have, I had to have a me moment throughout this experience. And I was so in denial that finally, when I was able to kind of like be like, you know what, this is real. When that reality finally hit for me personally, not anybody, I didn't care about what anybody thought. I was dealing with it. My body was dealing with it, you know, and people around me were who I told, confided in, because again, because my community did not talk about breast cancer because they would, it was a taboo. They looked at you like you were the disease itself. I refused to talk to anybody outside of people I trusted about what I was going through, because again, I was afraid of what they would think. And at that moment, I didn't need that stress. And I refused for anybody to stress me out when I have something, I'm fighting a battle that I could lose, you know? And again, I thought of it in the sense of this cancer is controlling my body. I will not allow it to control my mind. I had to gain that control. And it had, every day was a fight, you know, I would go through, you know, you'd cry, but then you'd be like, you know what, I'm going to fight. And you'd have to think about, you have to have a purpose, but don't give up, because cancer wants to. You have to tell yourself that there's a reason why you're going through this. You have to tell yourself that, you know what, I'm going to survive. You know, again, like Meg said, doctors don't know what they're talking about. They think you're not going to make it, but you have to push through. You know, you have to go and do. I had to go to treatment with a happy face, smiley face, you know. But moving forward, like you said, Liz, I took, when I finally came out, people, when I tell people I came out, they're like, what? But that's my happy moment. Just saying that I came out, it's like, wow, like I'm able to talk about this and laugh about it and think of how far I came. When I finally came out, I decided to tell my story on Facebook. I wrote a post on, I think I remember was Women's Day. And I just kind of like talked about, you know, coming from Africa, you know, coming from a war-torn country where I had to run away, you know, escape for my life. I had to fight for my life. And then coming to America, not thinking that something like cancer would also be, you know, having that chance of cancer, you know, fighting cancer. You know, I didn't have control when I was in Africa when these soldiers were chasing us. But now here I am again, fighting another war with cancer. You know, that battle was a second battle.
Yeah.
So I told that story and I kind of was like, you know what, I've been fighting breast cancer and I have cancer because I wasn't done with treatment. So I was still fighting for my life, but me finally telling somebody, it lifted so much weight out of me. It made me feel proud because again, it's a story, it's something that we don't talk about. And I wanted to make that statement clear, crystal clear, for the elders in my community that do not talk about it, for the people who are still fighting their life, to know that there's others like myself, like Meg, that went through it, and want them to hear our stories so that if they need any help, they can come to us. Now, fast forward, I've been doing so much stuff with reposting, especially on Breast Cancer Month. I just actually last weekend, I did a book for awareness with my friends. Again, it can just be, even if one person, 10, if 50 people come to the event and only 20 people get my message, that's still them listening. And that to me was enough. You know, I've been trying to advocate for people about breast cancer, that it's there. And I'm proud of how far I'm going. And I think I just want to continue and keep pushing and keep fighting for people, you know, people who've been through it and people who are going through it, because every day someone is diagnosed, every second.
That's right.
You know, so yeah.
That's right. And Meg, what are your thoughts about that? How you ended up where you are right now?
Well, you had to be an advocate. You had to, it's obviously I wouldn't be here today if I listened to my first doctor. So I'm so very grateful that I had the knowledge in me, the medical knowledge, to pursue other avenues, and finding the right doctor. And I trust him with my life. I do have, because of the 80% recurrence, I do return to MD Anderson every 3 months for an evaluation. Now, my cancer does not show up in any imaging whatsoever. There are no tumors present. There is nothing to indicate, there's no blood test to indicate the cancer is still in me. My cancer is located in the lining of my blood vessels. And so the only way to determine if the cancer is growing is to look for a bruise on any part of my body, or to check out my lungs to see if anything has grown in there, because that's the first place that it goes to. So I will tell you, it's very, very rare, but it does happen 9 to 12 years out from being a survivor. When I hit 5 years of being a survivor, I thought, this is great. I'm cool. I'm good to go, And God had a different plan. Now, I totally believe that we're not getting out of here without a big struggle. God had a struggle, and some of us get it through our children or whatever, or personally. It's very easy to fall into a pity party. Poor me, why me? I can say maybe I allowed myself 5 minutes in that little pity party, but it doesn't do you any good, because stress causes cancer. So you got to maintain positivity. You got to find the glow in every day. You got to sparkle on. I think when in tough situations, there's always an opportunity for our light to shine on somebody else, and we can make a difference in somebody else's lives. But when we do, it makes you feel so good inside. You keep wanting to do it. And I think that, I don't know what this outcome is. None of us know what the outcome is. We just have to find the joy in every day and a reason to smile every day.
That's right. And that positiveness is shining through both of you, I might add, to have gone through such struggles and faced those challenges, and to come out on top and be positive about it so that you can share your story with other people. One of the big challenges I think that happens with people that are not in the medical profession is that they don't know what questions that they should be asking their doctor. So the information is shared with you, and you don't know that you might have that someone else might think about 10 other questions to ask. So you don't know those questions. And they are, on the internet, there is a lot of good information about breast cancer awareness. And I came across recently questions that you should ask your doctor about breast cancer. And there's like 25 of them that make perfect sense to us as healthcare providers, but they are not questions that a non-healthcare provider person, a lay person, would definitely ask. So it's important that we as healthcare providers and people that are survivors of cancer advocate for other people and go with them to their appointments, or willing to listen to them and suggest that maybe they need to ask this question or that question to their physicians. Very, very important. I think the other things happen for a reason. Meg firmly believes in that, and so does Rita, and so do I, that we look back on our lives and the directions that happened, or the right-hand turn that we took because of a situation, resulted in something else. And in your country, in South Sudan, Rita, there are so many women that do not have access to really good health care, and nor do they know anything about the word cancer, just like you didn't, just like your mother, et cetera. Even though you're here in the United States, you may have heard some of it. And so maybe what's in your path is you survive this disease, and you go back out into the world, and you go home back to your country someday. Maybe you even come on a medical mission with Partners for World Health when we go to South Sudan and provide those kind of services, and that you reach out and educate the women about this and tell them about your story. Because there are so many people in our world, that women that have many kids and families, and if they're diagnosed with stage 4 breast cancer, they're not going to be around to be able to take care of their families. And it's really important that we help to educate the people in your country and many other places, as well as reach out to people here in our own country. Absolutely, to people here in our own country, and to go to different places to spread the word, because many people, even in our own country, don't even understand about the self-breast exam and early detection. Early detection saves lives, definitely saves lives. What else would you like to share, Meg?
Well, I think it's frustrating when you go through the side effects of chemotherapy, and I will say that I had terrible bone pain, and not one narcotic helped me at all. And it was excruciating, and I couldn't even walk down a flight of stairs. And my daughter would put me in an Epsom salt bath, and I felt great after that, but the pain came back. I am a firm believer now for medical marijuana. I never tried any of that before in my life. I'm a nurse who would do extracurricular drugs, no way. And my family decided I should give it a try. So they arrived with a big bag full of marijuana gummies. And I said, well, you all better sit around, because I don't know how this is going to affect me. I don't want to go crazy. And so I took a marijuana gummy, and within 45 minutes, all my pain was gone. It was a miracle. I could walk up and down the stairs, and I wasn't loopy. I guess you have to smoke it to get loopy, but I can't smoke anything. But I will say that that's the only thing that took away my pain. And it also helps you to sleep. You can't look down the road too far. You can only look for today, and get excited about waking up every day, because like they say, it is a gift. And so many are denied that opportunity. They're 6 feet under right now. So even though I don't have breasts, and even though I still have the opportunity to have this cancer raise its ugly head again, I'm not going to think about it. I'm just going to live my life and enjoy the people I meet, and share a little sparkle with everybody as you go on throughout your day. That's the only thing I can say is marijuana is great for the pain, but you need to stay positive and sparkle on. Try not to get too depressed and think too far down the road, because the first thing you want to do is cry and call your mother. Well, I didn't cry, but I tried to call my mother, and my mother was already passed on. So mothers make everything feel better. But I called my big sister, and she calmed me down, and she really she has saved my life. She's done, above and beyond all the work that needed to be done to get me to the right doctor. And I am forever grateful for you and your love for me.
So Rita, what are your last words?
My last word is, while, every time I talk about my experience, the sadness and all that stuff, I also talk about living, and people think that just because you have cancer or breast cancer or anything, that you need to be just confined in bed, or you have to look a certain way, skinny or whatever. No, even going through this, I still fought to be me. I fought to be me in a sense of, before I was diagnosed with cancer, I loved traveling. So even during the pandemic, I decided, some people, only my sister, I remember going to Jamaica, knew that I had breast cancer, and the other person didn't. I went to Jamaica. All the people on my social media at that moment, or people on my Snapchat, didn't know, but I was traveling. They were like, wow, you're living your best life. not knowing that I was living for, just because, they didn't know what I was struggling with. They were just, you always have people that will judge you, but you need to, while fighting for your life, don't let them get to you. Kind of, you have to be selfish. And I had to learn through this experience to be selfish for my own peace of mind. Don't allow anybody's stress to be the stress in your life. I had to tell people that, what, if you don't like me today because of whatever, it's fine. If we're going to beef because of whatever, it's fine. But I choose me. I have to be selfish and put myself first. If you want to fight with me later after I'm done with my treatment, or after I'm finally done with what I'm going through, because even with Meg, 5 years down, your body still feels tired. You still feel like that anxiety of that cancer can come back. Because I even told myself, I'm like, can I go through this again? No, I won't be as brave. When I went through this experience, I went through it lifeless. I went through it lifeless in a sense of, I just felt like a toy, a broken toy that the doctors were telling me to basically get all these treatments. I was low in my iron. I was low in so many stuff. And I would be even, with my water. Sometimes I had 2 bags of water every week. I would just go. They'd be like, Rita, we need you to take this medication. I'll go. So I just felt like a broken toy that needed to be put back together. But regardless, everyone around me, I was like, no, I will not allow you to disturb me, because I'm fighting for my life.
Right.
And that's what matters right now. I don't care about anything, and if you don't want to be my friend, knowing, especially those who knew what I was going through. And that's where the education part comes in. It's sad that, again, even my family even struggled with that, because I would get angry sometimes. But this was the stress, the anxiety, I don't even know, so many thoughts going through my mind. But it's the chemo controlling me. I wasn't the person I was in the beginning, and they didn't know that. They didn't know how to handle it. Again, that's where the education piece comes in place. But it was hard during the pandemic because I didn't have that resource.
Right.
I didn't have that hotline where those people can talk to my mother and tell her that this is what you should expect from your daughter. But then, even so, I was such a strong person. I wanted to be strong that at some point I kind of like even shut them out. I didn't want them to see me at my lowest. I didn't, because I felt like that'll make them cry and it'll make me cry, and it'll make me actually think about the cancer again. And I refused to think about it. I just wanted to be better,
And so you ended up developing all this courage.
Yes.
Right? You ended up developing all this courage, and we've all seen people in our lives, and they have been frail. They haven't been able to face terrible situations in their lives. And so for women, for you, for both of you, to develop this courage, be able to face this adversity and look at it with courage and with a positive nature is really a gift. And it's important to take that gift and show everybody else how they can have courage to fight whatever they're fighting too. Whatever they're fighting too. So I want to thank you both for sharing your stories this evening. It's really been a pleasure, and open it up to anyone who's here if they have any questions or comments. Feel free, just put your camera on, say hi, and love to hear from you for a few more minutes. Okay.
Well, I'll say that, it's easy to be afraid. It's easy to be fearful and have worry. But what I've learned is I have to give it to God, because you wouldn't be able to walk out of your house. So you just give all that worry to God and you walk in faith, and life is great. You get to see the beauty every day. It's worth the fight. Fight like a girl.
And Meg, you shared a funny comment earlier this week to me about the flamingo.
Oh, well, I think everybody should be a flamingo in a pack of pigeons, just keep flapping. and keep sparkling and moving on, because you know, you're special, and you need to continue to put yourself first, like Rita says, and believe in the power of prayer and believe in the power of God.
Pam, do you have any comments?
Well, I have to say, wow, this was a very powerful presentation. You both have an amazing amount of courage, and it's so important to share this. This was really good. I'm listening to the stories, and both of you had such a journey, and you're still on this journey, and you've had roadblocks in this journey, and it makes me wonder, like, how an average person can navigate a healthcare crisis like this without support or without the education. It just seems so daunting. And listening to the treatments you had to deal with and the advice and sometimes the incorrect advice, did you feel supported by the American healthcare system and the insurance system, or were there roadblocks there? Because that's always a worry.
Rita, do you have any thoughts about that? Supported by the healthcare system and maybe roadblocks to insurance coverage?
I remember, see, that's another issue. When I was working two jobs, I was diagnosed, and I think something that I struggle with, or I should have done, my mistake, as I put, is that I didn't have insurance at that time. So when I was diagnosed, it was, how it would work. There's a window, a certain month where you can get into insurance. Even if you're full-time, I had to wait basically another 6 to 8 months. So I remember being like, okay, what can I do now? So I had to basically reduce my hours in order for me to qualify for Maine Care. And until Maine Care, and it took a long time. I applied, but they were taking their sweet time. I don't know whether it was because of the pandemic or whatever, but I obviously couldn't start treatment until I had that approval from Maine Care. And it took a long time, to the point where social workers from New England cancer specialists had to call Maine Care and be like, what's going on? We need to start, because of how aggressive my cancer was,
Right,
and how soon they needed to start that treatment. So I did have that roadblock, even with, again, I felt like I wasn't given as much resources, even for when I started losing my hair. They sent me to some places to get hair custom made. And I remember I think it was Madeline. I walked in there and I come back and they showed me a receipt. It was like $1,600 for hair. I was like, whoa, where am I gonna get $1,600?
Yeah.
I think it was even 3,000. And I'm like, whoa, what kind of hair costs that amount of money? But other private insurance pay for that. Unfortunately, Maine Care is not covered by Maine Care. So again, you have that roadblock again. And with every step I took with these challenges, I was like, you know what? I'm hoping what I learned from these experiences, that I can pass it on to somebody who's like me, so that they don't go through that roadblock,
right,
or I can help them figure out an alternative. But no one was
Right.
able, I had no one walking me through that.
That-
They just told me, go here, not telling me that your insurance might not cover it. So those were a few roadblocks I had, again, with IVF, them telling me that Maine Care, or I had to basically get a scholarship or whatever. That was another roadblock.
Yeah.
So it was just communication,
It's
for someone who's African, for someone who doesn't know how to speak up, it will be hard for them, even going through this medically. I had to repeatedly ask questions. I had to repeatedly be like, okay, what does this mean? But most people won't do that, and again, that's, not trying to get off topic. I've had situation where people they don't know how to speak up. They don't know that what they're saying can even affect them later on.
Right.
You have to ask questions.
Right. And that is an important issue in our healthcare system, because it's very difficult for many people.
Yes.
What about some of those, in answer to Pam's question, Meg, that roadblocks you might have run into along the way with your journey?
Well, I learned early on when I started with my chemo, they had 120 chairs in this massive room. And you're just one of 120. Cancer does not discriminate. It doesn't matter how much money you have. It doesn't matter what kind of car you drive. You can still get a diagnosis of cancer, and nothing else matters but your fight. You don't think about, oh, I'm going to go on a cruise, or I'm going to do this, or how I'm going to pay for it. You just hope and pray, and you keep fighting. I mean, you ask to speak to the financial department in the hospital, and many of them will work with you. But I remember when my daughter was going through cancer, and the only pill that she could take that helped her was $320. When I picked it up at the pharmacy, they told me it was $320. So I gave them $3.20, and they said no. I said, one pill is $320, and it was the only pill that worked for her. And we had to max out our credit cards. So while you're fighting to live, you still have to, people fight to not lose their house, to fight, to be able to pay for the drive. It costs me at least $1,200 to $1,500 every 3 months when I go to MD Anderson. I can't afford that, but I'm going to go because it's my life, and I'll make a way, whether I pay him $2 at a time, it doesn't matter. I'm going to find a way to make it happen. But to donations today to various breast cancer clubs, most of that money goes to the hierarchy that runs it. Very little filters down to donations for this person to live in a hotel while I go to Houston for my cancer, or pay for meals for their caregiver that's going with them. These are things that people don't think about. And one of the things that my daughter was so amazing, and knew when she survived this cancer, she wanted to give back. So every year she has a Christmas party, and it's a breast cancer tree. And she invites people to tie pink ribbons with money on that tree. And every year she picks one woman who's really struggling with breast cancer. Maybe she's divorced, she's got 3 kids, and she needs this money. And she finds out through various organizations, and she honors that person. If everybody could hand out a little bit more to those people that really need it, and not these big institutions that it gets lost in their pay scale.
Mm.
Yeah.
Yeah, interesting comments for sure. Any other questions or comments?
Well, one thing I'll say is that when my daughter lost her hair, I reached out to Wigs, what is that? Hair for Love, or Wigs for Love, or something like that.
Locks
And
for love.
what Locks of Love.
Locks for love.
And what I found out was they only make wigs for 18-year-olds and down. They don't make wigs for, my daughter was 27. She wanted a fun wig. She wanted something, you're 27, you've lost your breast. Let me just, feel good about how I look. So, I was quite shocked. Now, granted, the cancer centers will give you wigs, but we've all seen those wigs in nursing homes. Okay, that doesn't work for them, or hats. But various hats. There are old lady hats, and we need to think about the age group and supply what they need to keep their positive feeling about their image.
Mm. Well, maybe we should go into the wig business next.
Well, yeah. I don't know. I didn't wear a wig. I was proud of my bald head. I said, this is a badge of hope for somebody else. It's a courage for me, but somebody sees I'm fighting something. And then they can see, well, she's still walking around. She's still fighting it. She's living her life. I wasn't concerned about my bald head. And I'm the only tennis player in my club that has no breasts. And my serve is phenomenal because they don't get in the way.
Thank you, Meg. And Rita, thank you.
Elizabeth,
Any other questions or comments?
Elizabeth,
Yes, Dr. Kirchi.
I think what we heard tonight speaks strongly to the need for universal health care. There should be no reason why anybody should have to struggle financially to the degree that was described this evening. I mean, it's an embarrassment to our nation compared to more progressive countries, certainly in Europe. And I hope eventually this will get better, but it remains to be seen.
Remains to be seen, is true. Well, any other thoughts or comments? And thank you for everyone for coming. And Rita, thank you very much for sharing your story. And Meg, thank you very much for sharing your story as well. And I wish you the best. And thank you again for participating and coming.
Love you, mean it.
Love you, mean it.
Love
Thank you
mean
for
it.
having me.
You're very
Great
welcome.
job. Great job. Thank you.
Bye.
Bye.
How do we do?